Welcome to CrackTalk.
Hey everybody, how you doing? Dr. J here with my boy Scott, and welcome back to CrackTalk. And boy, this week we got a good one.
Yes, we
It's
do.
all in your jaw. And what did you just say?
Unlock the jaw.
Unlock the jaw. So TMJ, what is it? How do you get rid of it? And what has chiropractic got to do with it? But we always like to remind everybody, Scott, hey, if you're liking what we're throwing down, like us, follow us, subscribe, make a comment, and then share the heck out of this information because we're doing it for you. And we already got the intel. We need you to get the intel so that you can be moved, touched, and inspired to live a life out of pain. In today's case, TMJ, without TMJ, or if you have someone, a loved one, a coworker, somebody in your ecosystem that's experienced a TMJ, make sure you get the intel over to them. Yep. We're not doing this just for funsies. We're doing it to have impact in your life and your ecosystem's life. So make it happen. Scott, what do you think about TMJ?
Well, this topic came about because last week I was at actually an industry up in northern Kentucky, and I was doing an event.
Yeah, man.
And I had a person come up to me and ask me this question. Said, does chiropractic, he goes, I got kind of a strange question. He said, can chiropractic help with TMJ? And I said, yes, it can. And he looked at me like, he goes, really? You know, had this puzzled look. I'm like, oh yeah. And then we started going into explaining it. So that is kind of where this originated from, because how many people are sitting out there and never tied those two together? It's like, well, chiropractic, how would it help me with TMJ?
It has nothing to do with your spine. So how would it?
How does that work?
You know, the last one we did was weight loss. You know, how do you lose weight? And how chiropractic, we brought those two together and how they're symbiotic.
Yes.
Same thing with the jaw. It blows my mind the amount of people that walk into our office on a daily that are dealing with TMJ. So I always like to start out with some stats because I was even talking to you, Scott. You said TMJ. I was like, holy crap. There's so many people dealing with TMJ, from, you know, small cases where it's not so bad to just extreme cases where it's kind of affecting their life so negatively that they're going across the globe to get help.
Well, what was interesting is the person that asked me this question was a male, and he was, I think, 26.
Young.
So that was the other thing that I really wanted to bring this to light, was because TMJ is one of those things that when I think of it, I think of older. TMJ pain. That is not the case.
No, I don't think TMJ has an age distinction. Right. It is more prevalent in women than men, slightly. But here, just listen to the stat. 5 to 12% of the United States population are dealing with some type on the scale of TMJ.
Wow.
5 to 12%. I was blown away.
That's more than
I thought it was going to be 1%, maybe 2%.
30% max.
And so what is TMJ? I always like to talk about it. So what is TMJ? Because a lot of you that are listening maybe the first time are like, well, I have jaw issues or whatever. What is it?
Well, you're like me. I've heard of TMJ.
Yeah, we've all heard of TMJ.
But what exactly is it? I don't know.
Transmandibular joint, TMJ, which is the joint right here in your jaw. The two joints that your jaw hooks to your skull, right? And then there's a whole bunch of bones, ligaments, and tendons. It's actually right here. Your teeth are connected to it, so to speak. But what is it? The most common symptom of TMJ is clicking and popping when you just move your jaw.
Gotcha.
When you chew, pops. You know, listen, man, my dad, I sat there at the dinner table all year and he had the TMJ, never complained about it, but his jaw would pop. I had to sit at the other end of the table. And I hate that I did that, but I just had it. There's probably some kind of condition where you can't stand to hear somebody chewing. I can't remember what it's called, some crazy name, right? Some kind of phobia. I may have a little bit of that in my life.
He's got a few of those.
I got a few of those. Yeah, a little OCD in my life. It's okay, everybody.
He's got a few. I'll just share that.
Take it easy.
All right. I'm with
But here we go with the TMJ. So my dad had the clicking and popping with chewing, pain in the jaw, pain right here over this. Associated headaches where there's pain in your jaw, but it actually creates a headache. Or ear pain or ringing in the ear can also be symptoms of TMJ. Locking of the jaw, like you get, and it just kind of gets locked in a position. So if you're having any of those symptoms, you have clinically diagnosed TMJ. You can look it up at Google, WebMD, or go to your family practitioner. And if you're having any of these symptoms, they're going to say, well, you have TMJ. Now it's like, well, what the heck
what do you do now?
Well, therein lies the problem, Scott. Yeah. What do you do? So natural thing is, here, take muscle relaxer.
Take a muscle relaxer, learn to live with it.
Painkiller.
Learn to live with it.
Yeah, that's the other thing. Learn to live with it. Take a muscle relaxer because you got to relax those muscles that are there, or massage it. I mean, I hear so much stuff, and a lot of it's very, very appropriate. So the first thing I like to talk about is, let's reverse engineer it. If it's muscle, ligament, and tendon based, that means, and it's a mechanical joint, is it aligned properly? And that's where we start with all of our patients in this chiropractic office, and where most chiropractors start. We talk first about the alignment of the spine. Is your spine subluxated, which we talk on this podcast all the time, making sure all 24 bones are unsubluxated, which is one of them moved out of place, putting pressure on the nerves, and it creates dysfunction or lack of communication between your brain and your body. Well, the same kind of thing can happen right here, and there's actually a joint on both sides. And Scott, when that gets out of balance because a muscle goes into spasm, maybe you're laying on too much, maybe you got a knuckle sandwich on the playground. I don't know what you guys are doing in your free time, right? But forced trauma, right? Stress, grinding your teeth like this, sleeping and grinding your teeth. These type of things are prevalent amongst people. And I don't know about any of you that are on those podcasts today. I know right now I'm sitting more stressed out in life as my kids have aged up. I worry about them. I worry about my grandbaby. I worry about all our employees. I worry about our patients. I mean, we're living in probably one of the most stressful times coming out of COVID. I thought that was the most stressful. Now you got people, Scott, that can't even afford to live, and you know what they're doing? They're going to sleep and they're grinding their teeth, and they're holding back their Facebook posts because they're grinding their teeth, right? And they're creating TMJ. That's why I think the prevalence rate has went up so much, from 5 all the way up to 12%. Stress. You can't have physical trauma. Okay, car accident, punch to the face, or what I said, sports, getting a concussion, having some kind of thing rack your jaw. But stress is probably the ones I'm feeling. It brings it on with patients.
I didn't think about that. I didn't. That didn't.
You have these big muscles right here called your SCM. You just like that. You see those right there, right? Those all come and hook with the jaw. Guess what happens when you're stressed? They tighten up. Your freaking neck muscles tighten up. Your trap muscles right here tighten up. And all of that stuff, if it gets out of balance, can shift your jaw. So when you're opening and closing your jaw, and we're doing this on a repetitive basis, whether you like it or not, because I don't think anybody in this day and age is keeping their mouth shut. Even when they're texting, they're not keeping their mouth shut. You know what I'm saying? No pun intended right there. Even when they're dropping that Facebook post or that comment or that DM, they're using their jaw, usually they're clenching like this. But when you stress these areas out, you can create an imbalance, which we call it in the chiropractic office. You can have a subluxated jaw.
Wow, okay.
Yeah, and what does a chiropractor do? Well, I got about 10, 15 patients right back here on the tables come in, and I had probably the worst case I've ever had. Girl comes in and says, I've been to 3 chiropractors. They say they don't deal with TMJ. I said, well, I deal with TMJ, but now I'm worried. And she says, look at this. Every time she opens her jaw, click. And the jaw completely moves over. Well, I'm going to tell you the most extreme case. And what have we been doing with it? Adjusting it in rhythm. So she's been getting adjusted about 3 times a week for about the last month. And now, just over the last couple of weeks, we've started seeing the clicking sound start to subside. Just a smidge, no pain.
Wow.
So it's making a mechanical noise, but it's not irritating her. So we've taken that jaw, and it's going to take some more time, because just like physical medicine, which we talk about all the time, everybody wants the quick fix. They want I always call the Benny Hinn, hit you on the forehead, your brace goes up on the wall, you're healed for life, right? Now you can walk. It's not the way it works in physical medicine. Physical medicine, you're dealing with muscles, ligaments, and tendons, and nerves. The nerves need to be retrained. The muscles have to be retrained. And the ligaments and tendons need to be restretched.
And that takes time.
It takes time. And that's probably the hidden thing in chiropractic, in most medicine, is everybody's been taught, okay, take this Tylenol, pain goes away. Well, the symptom went away, but the cause of the problem didn't go away. The challenge with TMJ, this is why, Scott, I think it's so hard to treat, is because the only way to treat it is by physically retraining everything that's around the jaw to unsubluxate the jaw while you're working it, and to hold it in the proper juxtaposition to where you're talking through the day or chewing gum or chewing food, and it's articulating properly in the joints, not inflaming the joint capsules. right? Because what happens is you get that disarticulation,
Yeah.
and now you're having strain in the joint, creates inflammation.
Right.
Inflammation over a long period of time becomes arthritis.
Wow.
Right? This is why they give you muscle relaxers. They give you the painkillers. They'll give you the steroids for these kind of things. So they're trying to calm everything down to allow that to seize out and go back to our normal juxtaposition, right? So what do we do in the chiropractic office? We adjust it. We take, just like we adjust your spine, we take the jaw, we adjust both sides of articulating joints, your TMJ joints, right? And we adjust them.
Okay.
Over a period of time, and hopefully then do some exercises and some stretching with these muscles, as well as your jaw muscles, and it includes massaging those muscles. Sometimes you need to get a mouth guard because you might have an overbite, you know what it is,
Yeah, or an underbite.
or an underbite, and you need to get a mouthpiece. And often there's
Right.
people, oral surgeons are big on those. If you're gritting your teeth at night because of stress, I'm going to tell you, dealing with stress, I've not figured it out.
Well, here again, this is a whole other episode that we talked about.
But you got to relax the jaw because that's where most people are clenching their jaw outside of chewing.
Right.
And that creates the TMJ syndrome.
Yeah, and if you're doing it at night, that's tough because there's nothing you can do while you're asleep.
You gotta
just
get a
grip
mouth
those-
guard.
Yeah, and that's what I see mostly for TMJ as far as remedies is the mouth guards. But they're leaving out that piece of actually putting
You can wear a mouth guard as much as you want. I'm telling you, everybody out here, you can wear the mouth guard, and hopefully you're reducing the amount of grinding, because the biggest reason they have the mouth guard is so you don't grind your teeth down to nubs, because you can grind those, and I've done this.
I've got it. I'm doing it.
We're the chosen two, obviously, that already have TMJ symptoms. But it's one of those things where I've learned now to relax my jaw when I sleep. I hardly grind. Spoken to me by my wife. She said, you're not as tense when you're sleeping, because I am like consciously trying to like keep myself out of that mode, because I wake up with headaches sometimes because of the grinding due to stress. So one of the biggest ways to reduce TMJ is figure out how to manage stress in your life. And folks, look, not easy, Scott, right?
But as we said in an earlier podcast, we were talking about one way to deal with stress is chiropractic.
And get out of pain.
Yes.
Because if your jaw's in pain, it leads to more stress. I can't imagine the young lady that was coming in here chewing food, and every time, and just that joint
And
just
then the pain,
jamming. Then the pain.
hammering, yeah.
She said she only want to eat food.
Yeah,
She said, I would rather all my food be drank through a straw.
Yeah.
And dude, you're talking about a 25-year-old woman that should not even be thinking about that type of condition in her life. So what do you do? If you have TMJ, first thing I do, I say go to a chiropractor, or first get a recommendation of a chiropractor in your ecosystem. Ask for a referral and say, hey, is anybody in your Facebook group, your Instagram group, whoever, whatever group you're in, your church group, has anybody went to a chiropractor and then successfully adjust TMJ to where the person has gotten good results, called get out of pain, and the jaw's gotten stable. So that'd be my first recommendation. Go into the chiropractic office, let them take a couple x-rays of your neck as well as your jaw, make sure there's nothing malformed.
Can you see it in an x-ray?
Yes. So you can't see, you can see a major misalignment, you can't see a minor misalignment.
Okay.
Yeah, it's very, very difficult. So what we do here is we'll take a picture of the jaw open, and then the jaw closed, and we're looking at the joints, making sure the joint space is equal side to side. Because really, whenever you're analyzing somebody's x-rays, you're looking for symmetry. Now, asymmetry, like if you have a skull condition or if you have an anomaly, a genetic anomaly where your jaw is just malformed, you may not be able to get rid of the TMJ symptoms, or if your skull's malformed, or if you've had a massive accident where you maybe have fractured your jaw, fractured your face, something like that. I'm going to tell you, the risk you've ran with that injury is it may or may not ever be able to go away. But still, to that point, I would go to the chiro and get it checked.
Keep it in alignment. Even if you have that injury, make sure that it is in alignment and functioning correctly within the joints.
Yeah, and what I would say, there's multiple different approaches that I take. There's about 4 different ways that I adjust the jaw. I can go from highly like physical with it all the way down to instrument adjusting, which is what I use for pediatrics and geriatric. So you want to find a chiropractor that is that agile. They can say, okay, you got the joint, it is popping, you have an imbalance in the muscle, I need you to do these stretches, these exercises, and then also we're going to adjust this jaw in rhythm, as well as usually I only do the jaw as well as if I'm adjusting the neck, because this is the other thing, Scott, is all these nerves that are here are going to the muscles here.
I was going to ask you that, is the nerves that come, aren't there nerves that actually come in and out of the jaw?
Come right down through here. And if these bones are subluxated, or your occiput is jammed on your atlas, which is that first bone, you can have TMJ just due to a subluxation.
I was going to ask you, that's great that you went here, because I was going to take the conversation there and say, okay, TMJ symptoms in the jaw joints here. There's something that's out of alignment, whatever. We're not. Can it happen to where if you have a subluxation up here in the upper cervical, if those nerves, which I know run down into the face and the jaw, can it give you TMJ symptoms
100%.
based off of a subluxation?
Well, because whenever you're subluxated, you're creating there's a misalignment of your spine that's putting pressure on nerves. It's interfering with the nerve flow down to and from those nerves. So down to whatever organ, cell, and tissue is being affected by that nerve, and then the information coming back is now malaffected, right? And when this happens, you can start getting an imbalance of how this muscle fires to this muscle.
Gotcha.
So when you open your jaw, you can be like cockeyed, because this muscle's firing a millisecond slower than this one. Or this one's in a spasm, which is pulling your jaw off to the side, and you don't understand, like every time you talk, why your jaw's translating to one side, because that muscle's in a spasm. Right. So you can sit there and massage it and massage it and massage it, and you're like, man, it's super tender. My sister does a great TMJ facial massage. And I'm going to tell you what, I don't know if anybody on this camera has ever gotten that done, but woo, they hit that trigger point. If you have TMJ, which I have a little bit of, and they hit that trigger point in those buccinator muscles right there, oh, baby, you will want to scream.
It's a good time.
It's a really good time. But that's also one of those indications, like if you push right there and you have a lot of pain and discomfort, you have some TMJ, you're going to go get some help.
So all right, so let's do that, because I was going to ask you some.
If you just put your hands here, right here, and you open your jaw and you hear clicking and popping, you're going to feel your jaw open. I can feel right here. Yeah, I click. I pop. My kids are probably trying to sit at the other end of the table like I did with my dad.
Now, see, if I push here, I've got pain on this side.
Yeah, so you probably need to get it adjusted. So what we do is we clear out the jaw, and then we also Scott, clear out the neck to make sure that we have all the proper nerve flow and that we have all the joints properly aligned. And then there's some things that you got to do at home to make sure you are massaging these muscles, you are stretching them properly.
Does that help if you just massage like that?
Yes.
Let's say, are there a couple tips and tricks, things I guess, like you massage here? Is there a stretch or anything?
Stretching your jaw open, and they do these things. I mean, stretching it open. Yep. Also, coming up and holding your jaw back, getting these muscles activated.
Oh, almost doing almost like a
and what they show a lot of these online. They've become it's become the new get your face slim. I've seen it on the Instagram, or get that real sexy pose, the duck lip. Like this, what you do is they put that mouth guard that's chewy, and they just chew on it. The good thing about that is you're activating all these muscles in your face, including the buccinator muscles, which are the most prevalent from causing the imbalance in the jaw. And you'll activate them, work them out just like a regular muscle. You bring balance from side to side, your jaw pain could go away.
What's interesting is that's funny is when I played football, having a mouth guard in the whole time. I would sit there and I would chew, and I tell you, the muscles right here, I mean, there was almost like points on the side of my face because I had built those muscles. That's much a.
Did you hear me was saying he had that slim face?
I got this.
As seen on TV.
As seen, it works. It works. Just get a mouthpiece. Hey, save money. Go buy just a mouthpiece like your kids
chew
wear,
it up
as they wear in their football helmets. Just chew that thing, you'll build it. You'll get the slim face.
So if you have TMJ, or if any of this is relating to you or anybody you know in your ecosystem is having these type of symptoms, my first thing is to get to a chiro that can address TMJ from multiple approaches, right? The next thing is just rest, stress management, right? Always hydration. You always want to make sure all these muscles are hydrated, because how you get inflammation out of joints is by getting fluids in and getting fluids out, doing some jaw stretching and strengthening exercise, which we just talked about. And if you're grinding while you're sleeping, get a mouth guard. These would be my suggestions as your chiropractor if you were coming to me and have been suggested to every other chiropractor or every other patient that's come in here with this. Now, here it is. It's usually not a one and done situation. You're going to get adjusted by me multiple times in a row over a course of a month, 2 months, 3 months, because we really know and understand physical medicine. It's like going to the gym. You just don't go get these biceps that Scott's got hitting biceps one day. You have to be a repeated offense every 3 days, hitting that muscle, letting it heal, hitting it again, letting it heal, so you get that body healing a rhythm. And it's like magic, Scott. All of a sudden people stop having the ringing in the ears. They'll still have maybe a little clicking and popping, but the pain subsides. You know, and all of a sudden, along with it, their neck starts feeling better. So it's usually not just one.
Right.
It's one and all the others. That's one of the greatest things I think about chiropractic is we take that holistic approach and we say, okay, your jaw hurts, but let's reverse engineer from that. These muscles, these nerves, these bones, these muscles, they're all having to work together for your jaw to function properly.
Yeah, and that's what we always say we look for, and most chiros look for the root cause. So that's one of those, you just follow the nerves, wherever that area is, follow them back, and typically you will get to pretty much the source.
You'll get to the source. And pain is a great indicator of having a problem. It's just not the indicator that where the pain is where the problem is coming from. And that's probably the biggest thing that we try to push in chiropractic is, you know, sciatica, that doesn't mean your leg is bad. That means you have either a subluxation, a disc, or something has happened in your low back. You don't even usually feel it in your low back. You get the shooting pain down the leg, or your foot's going numb, or, you know, things like that. So what we like to do is, hey, having jaw pain, clicking and popping, soreness, locking, these kind of things are indication that you have TMJ symptoms. Get into your chiro, get seen, get some x-rays, let the doctor work on you over a period of time, and I hope for each and every one of you that you can get out of locked jaw, or you can get out of TMJ symptoms and not be one of the 5 to 12% of the U.S. populations, which I'm still astounded by the stats, Scott. And I don't know if women are more common in having it because they possibly talk more. I don't know. I don't know if that's a true stat. Maybe I have TMJ because I talk a lot. My wife would appreciate if there was a brace. I think they call it duct tape.
Yes.
Okay. So that's all we have today for TMJ, Scott. I think it was wonderful. Power pack. If you or your loved one or somebody in your ecosystem is dealing with it, get them this podcast today. Remember, like, share, make a comment, subscribe right down below.
We're going to hit 1,000.
Come on,
We're still getting there. We're close.
Help us get to 1,000 because we just want to have impact. We're doing this for you. We're feeding up this information each and every week because we want to help people outside of the four walls of our clinic understand why they should be in the four walls of a chiropractic office.
I want the gentleman that asked me about TMJ. You know, I know that he's not the only one. So when I get these questions and I'm out and about in the community and I get this, I'm like, okay, if you're asking me this, how many other people have no concept or idea that chiropractic can help a TMJ, weight loss, stress, digestion, whatever. So that's why we do it. I mean, if we can help that one person.
And here, what do we do, Scott? We want to educate people. That's the first thing we do. I hope everybody felt educated on TMJ. You probably learned more than you wanted to know on TMJ. The next one is give you get some inspiration that you don't have to live with it. Because that's the one thing I deal with a lot in the office is I got the degenerative arthritis, I got the TMJ, I got the neck pain, I got the low back pain, and people have had surgery and they've been told, dude, this is just where you're at and you got to live with this the rest of your life. I do not take that answer. Denied. And I hope each and every one of you that are watching CrackTalk are denying that living with it is a real thing. All right. And the last thing we always like to add is the action steps. We just went through the action steps of how to properly deal it. And it starts with getting proper alignment of the jaw and then getting the whole situation, the nerves, ligaments, and tendons working together and then doing the other things. All right. So welcome to this week's episode of CrackTalk TMJ. We just finishing up, Scott. Woo.
Got nothing. Hey, we've covered it.
All right. Thank you for joining us. Make sure to share, make sure to comment, make sure to subscribe, and make sure to like this thing because we got to get to that 1,000.
Yes,
Come on, Scott. Give it there. Boop. You guys have a great one. See you next week.
Need your help. See you guys.